Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show. Listen to the experience two residents had at the special needs clinic. Parents and caregivers often express gratitude and relief for the special needs clinic. Now let's hear about the experience of one of their patients, Kevin, and his father, Anthony.
Kevin is one that brings a smile to my face. And the fact that we schedule one-on-one with our patients and their families allowed him the opportunity to come inside, get to know us, get acclimated to the office in the process. It was a really awesome experience because today we were able to do something for Kevin that mom and dad have never been able to do, which is allow him to get a cleaning and fillings done without any general anesthesia.
The previous dentist we went to, we weren't satisfied with because it was a once-a-year deal, knocking him out completely just to get him to cooperate. It was, let's take you around the back because he's screaming and hollering. It wasn't, let's see what's wrong with him or calm him down. That's just something we don't like. He has feelings. He's happy, he smiles, he cries, he does all these things. So now when we're here, it's through the front door. How you doing? How's everything? So he's comfortable who he's with, who he's seeing. So having him comfortable when he came in was the key. That's all we care about. How are they treating him? How's my son? So the fact that he's just right now sitting there comfortably, that is amazing. There's amazing things that happen here that we normally have not seen. So that is an absolute win for me.
Hi, my name is Dr. Somto Akamnono. I'm a second-year pediatric dental resident here with NYU Langone and Phoenix, Arizona site. My background is, was originally born and raised in Nigeria, and I migrated in 2014 to join my family, and they've been living here for over 20 years. So growing up, my childhood experience was very, very kind of unique because my mom is a dentist and my dad being a physician, they had their own practice back home. So as a child, I was always, following my mom. When she takes me back from school, I follow her to her dental clinic. And that was actually my first dental exposure. And right from time, I just wanted to get into a field where, I could render dental services to kids. And also, coming from a third world country, we had a lot of kids that were from very underserved populations. They had no idea of what dental and oral health was all about. So I actually knew from a very young age that I wanted to go into a profession that would, tender to kids from a very young age, and and also patients that have special needs that have nowhere to go. They can always be taken care of. So as soon as I finished my dental school in Nigeria, I worked for a couple of years and I moved over to the States and I went back to dental school. And that was like a second experience, but that was so cool because it helped me, really know that this was exactly what I wanted to do in life. And it's been a very exciting journey. I applied to the NYU Langone and I got accepted in 2019, and I started my journey here, and it's been exciting so far. And we've had the privilege to rotate here at the PDS Foundation. This was something I never thought I could get an experience in, and it's been so exciting and welcoming. The clinic it's a very, very conducive environment, and everyone works as a team, and it's been really been amazing so far. And I look forward to getting as much as this experience I can get from this rotation and also from my residency program, and I'll take that back. I could go back home and help, the underprivileged, and also be able to attend to patients that need, special attention and that have nowhere to go. That's what I'm hoping to achieve from this residency and rotation here.
Hello, my name is Dr. Scott Randall. So I'm a first-year pediatric resident here at the Phoenix program. And so my journey started before right after graduating dental school and before coming to residency, I was in the Navy for 6 years. So my path was a little bit different, but I always had kind of a strong desire to serve kids, and it started with my experiences in dental school, and then a little bit when I started with the Navy and my GPR experience. But the goal was always to work with kids, and I had a great opportunity to do so in San Diego with the Navy, and then also in Japan when I was treating kids in Japan, dependents of the military that were deployed in Japan. So it was a great experience, and it's always been a goal of mine. So I'm very excited to be here and to have been accepted to a program. But I've always just felt like kids are really special. I really have enjoyed working with kids, and a lot of times they're the ones who need the most help, and sometimes don't know how to get the help. So it's really important to me. I'm also a father. I have 3 kids who have all had their own dental needs as they've gotten older, and so I think it's really important that we take care of our kids and take care of their oral health, because their oral health is important if we want them to be 100% healthy. But we have just started this rotation here at the Special Needs Clinic, and it has been a great opportunity because I think it goes hand in hand with what we're trying to learn and accomplish with being specialists and focusing on kids. Is that here we're treating a population that is very underserved, or treating a population that might have been turned away at times from other providers. And if I want to be a specialist in my field, if I want to be a specialist in pediatric dentistry, I need to be able to be willing and able to serve the population who may not be able to be served by the majority of clinics around here. So I think it's a great opportunity to see a lot of variety, a lot of different types of patients, even if they aren't kids. We're seeing a lot of adults here as well that have a lot of needs. But I think it's very applicable to our training, because we're going to be the ones who will be treating those patients as well. And we shouldn't be turning those patients away. And so if any experience I can get here to help me be more comfortable, I think the biggest thing is maybe a lot of people just fear what they don't know. And when we understand how to treat these patients, we'll do a better job at getting them the access of care that they want. So that's kind of what I'm hoping to get out of this rotation here.
Hello, and welcome to the Group Dentistry Now show, the voice of the DSO industry. I'm Kim Larson, and this is Bill Newman. And today we're talking about the Pacific Dental Services Foundation Dentists for Special Needs Clinic and NYU Langone Pediatric Residency Program.
Thanks, Kim.
Sure.
And we have 2 special guests here today. One, Kyle Guerin, actually was on the show, I think about this time last year. So welcome back, Kyle.
Great to be back. Thanks for having me again.
Yeah, absolutely. And we also have Dr. Akilesh. Welcome to the Group Dentistry Now show.
Pleasure to be here.
So I'll give you a little bit of background on both gentlemen that we have here. So Kyle, who I mentioned was already on the show last year. Kyle is currently the director for Pacific Dental Services Foundation and Corporate Social Responsibility. His background is in marketing and events, and some really interesting background here, Kyle. So he worked executing large-scale experiential events for Chrysler, Jeep, Dodge, and the Detroit Pistons. And he worked with the legendary former UCLA basketball coach, John Wooden. That's pretty cool. But found his niche in the field of corporate social responsibility at PDS. Was that about 10 years ago, it looks like. And that's how he got into healthcare. So he's led over 25 international dental service trips to places like Ethiopia, Fiji, Guatemala. He's built 15 playgrounds with some help. With the Kaboom program, and helped provide clean drinking water for over 175,000 people in need. So great accomplishments. So again, welcome, Kyle. I'll give you a little bit of background on Dr. Akilesh. So he is the Senior Associate Program Director of Advanced Education in Pediatric Dentistry at NYU Langone Dental Medicine in their Postdoctoral Residency Program. It's a mouthful. So he is based out of Phoenix, Arizona, and prior to moving to Phoenix, he was the Associate Program Director at NYU Langone's Providence, Rhode Island site. Dr. Akilesh currently oversees program sites in Arizona, Missouri, and Washington State. Education-wise, he has his dental degree from Harvard School of Dental Medicine. He also has his master's in public health from Harvard, and his certificate in pediatric dentistry from the University of Connecticut. So again, gentlemen, thanks for being here today. Welcome to the Group Dentistry Now show.
Yeah,
Thank
thanks
you.
for joining us,
Thank you.
guys. Kyle, so what's changed since we last spoke about the PDS Foundation about a year ago?
Man, what hasn't changed? It has been a whirlwind. As you know, it's funny. Our chairman of the board and CEO, Steve Thorne, said, getting it built was going to be the easy part, and now trying to, run it, figure this out, solve this issue, really would be the challenging part. And he's absolutely right. So last time when we were on, we kicked the clinic off with Dr. Dent. Dr. Dent was leading us from Houston, just really getting us started, coming into Arizona, and he gets all of a sudden he gets diagnosed with cancer and goes through this incredible health journey. Thankfully, he's doing fine. He's in remission, just absolutely doing fine, which is great. He then, we bring in another clinician, spend about a year with him, just much like this whole issue of just trying to find the right fit to serve this patient population. We struggled. We continued to try to implement new things, and have finally landed with this. I guess this just I'm going to gush over him a little bit. Dr. David Jarabshi, who is a pediatric dentist that sees adult patients with special needs. It's been, gosh, I think 17 months, 18, 19 months since we've opened, and it's been a whirlwind is the best way to describe it. But we're making incredible, it's each patient that comes in, you get these stories and you get these experiences and you meet these parents and you see these smiles. And when you're able to get a patient to get to open their mouth or get x-rays or get a prophy for the first time, it's so amazing to see that, and the joy and the relief on a caretaker's face. So it has been exciting, challenging, tears, sweat, exuberance, all of those things. It's really been an incredible journey.
Well, it's impressive and heartwarming. Just watching the video of the clinic, it does bring a tear to your eye. There is a real need for this. So tell us about the need for dentists to serve special needs patients.
The numbers range, right? Different studies, but we estimate there's between 52 and 60 million Americans with intellectual developmental disability. And the numbers say that only 10% of dentists are really prepared or willing to see this patient population. So what we're seeing all the time is just the desperation for a place to come and to be seen and to find this dental home. So what we're seeing, we're getting people that are driving hundreds of miles from different states that are just so, like, you can feel the weight come off their shoulders when they're able to find a dental home and a dentist that can see them and work with them and provide the just level of care that they deserve. And whether that's the know-how, the knowledge, the empathy, the insurance, acceptance of their insurance, all the challenges that go into that this audience has to face, that we've been able to overcome.
So why do you think more dentists don't see patients with special needs?
I know this is only about a half-hour show, Kim, so I won't go into we could go on for hours and hours and hours of this. And, there's so much work being done across the country and thought leaders and discussions, but I think it's a real simple one. The biggest one we see, and that's, a lot of this, why we're so excited to be partnering with Dr. Akilesh, is just the lack of education and training. Pediatric dentists get more of this training as part of their programs, but so many dentists, they don't get anything. Maybe it's 1 week, or for a lot of the universities, more and more are having some sort of rotation, some sort of, a lot of them have their own special needs clinic. You're seeing more and more, and we're slowly seeing a very slow charging movement towards more education, towards more of that dental school curriculum. But it just is this fear. Of not getting in a place where you don't starting it without being able to complete or able to just it's a little bit challenging, and there's that just unwillingness to try to tackle that.
So I'd like to add to what Kyle said. With treatment of special needs patients, their treatment can be extremely complex. And even a seasoned practitioner can feel like they're in over their head because there's considerations that are coming from every aspect of the patient's life that are going to impact the kind of treatment that you can do and how successful the treatment is going to be both short-term and long-term. And to touch on another point that Kyle mentioned, education is a big part of it. Whether it's the medical field or it's the dental profession, it has been shown that if residents or students are not exposed to information or techniques or procedures as part of their initial training, they are much less likely to engage in them once they graduate and they're in practice. And so for special needs patients, for dental students and also for residency programs to have that exposure, it's critical because you can't really expect a graduate from a program to then go out and do something that they haven't been trained to do. They're not going to feel comfortable doing that.
Absolutely. And it seems like new dentists do want to give back to the community. So Dr. Akilesh, tell us about the Pediatric Residency Program.
So as Bill said, our program is NYU Langone Dental Medicine's Pediatric Dentistry Residency Program. It is a very long name. We have been in Phoenix, Arizona since 2014. Our program has 14 sites nationwide, spanning the continental US, and we even have a site in Hawaii and another site in Alaska. So we're across pretty much all the time zones. Our program has thus far graduated 533 pediatric dentists since it began in 1994. And our Phoenix site alone has graduated 20 pediatric dentists since 2014, which I think is pretty impressive. Our program is unique because it's based out of community clinics across the country. And we're affiliated with local hospitals for the medical rotations, which are a requirement of the specialty training for our residents. And then in Phoenix, we're also affiliated with several institutions. And our most recent partnership has been with the PDS Foundation. So our residents could actually rotate to the dentists for special needs clinic and get more exposure to treating patients with special needs.
So why did you partner with PDS on this residency program?
So that's a good question. So our program is a hospital-based residency program. And I think being located in Phoenix, many people may not remember that our hospital is actually based out of Brooklyn. So our home site, our hospital is in Brooklyn, New York. Mm-hmm. And we have always believed that the best way to train our residents to have a productive career in the specialty of pediatric dentistry would be to expose them to environments where they're actually going to get real world experience. So real world experience is really something that applicants to our program are looking for. Mm-hmm. They could have the opportunity to go to a university-based program, but they're choosing to apply and to come to our program because they want that real world experience. And I think for us, PDS was a natural choice because PDS's core set of values, I mean, one of them I think is, it's almost like a version of ours, clinicians leading clinicians in clinical excellence. Mm-hmm. And I think that's just another real way of saying that you need to have real world experience and you need to be mentored by people who are doing what you aspire to be doing. And if you can have that as part of your training, then I don't think your education can get any more thorough and any more a solid foundation than that.
The hands-on experience is critical. And I think all dental students and residents would agree with that. Kyle, do you have any thoughts about?
Yeah, and I just wanted to say, Kim, it was funny. We invited Dr. Akilesh to our ribbon cutting, and this is the first time I'd ever met Dr. Akilesh, and he came up right away, and he's like, Kyle, we've got to do this pediatric residency program. It would be amazing. And he had so much enthusiasm and just really I loved his heart, and I had to almost we wanted to we just needed to get our ducks in a row and get things in order. And so it took us, and he waited patiently and would check in with me all the time. But once we were finally able to launch it and get going, it's been just really cool to get started and really expose more of the residents to this, this patient population.
It sounds like an incredible program. What are you hoping, Dr. Akilesh, that the residents are going to take away from this program?
So as I mentioned before, the real world experience I think is really critical for the residents. The candidates who apply to our program to be residents with us in Phoenix are hands-on learners, just like you touched on. And many of them they're all already dentists. So they've all graduated from dental school successfully. Many of them have state licenses. Most of our residents have also had a few years of practice experience as general dentists before deciding to come back, realizing that they actually need additional training in order to specialize in pediatric dentistry. And so I think for our residents, they understand that their education is not confined just to the walls of an academic institution. And my hope with really partnering with PDS Foundation was that my residents also get exposure to DSOs as well, and understand that the role of DSOs today in dentistry, and the role that they play in providing access to care, especially for some of them. I mean, the most persistent problem that our profession faces is access to care. And so if the residents, again, going back to what I was saying about treating special needs patients, even just the model of a DSO and the model of a community clinic, if that's something that they're exposed to during their residency, it will be a consideration for a potential career path when they graduate from the program and decide to look for a job. So I think this is, so they get exposure to really all of those things all in one setting. And that would be, that would be the PDS Foundation's clinic. So I think it's great.
I wanted to throw a quick question out there to either one or both of you, but what's the length of time somebody would spend with PDS in this residency program, and what, maybe take us through a little bit about that journey, what that looks like.
So we started rotating our residents. They have been rotating for probably about 5 weeks now, and we're working. So we're in the middle of the academic year currently. So we're slowly phasing our residents in. We're also making sure that Dr. Jarapchi is able to supervise the residents adequately, and he's comfortable with where the residents are in terms of the experience that they bring to the clinic and working with him. So our hope is really that our residents we would probably have at least a couple of residents rotating to the PDS Foundation clinic for at least 2 to 3 days a week. That's our hope. And that's something that I think both Kyle and I are open to changing that and hopefully increasing that based on the feedback that we get from both sides.
Excellent.
So Dr. Akilesh shared his goals for the program. Kyle, what are your goals for the program?
Our big goals are really just to increase the overall scope. Our whole dream and vision when we kicked this off was to big dreams, right, of increased access to care across the United States. And so even within this model of, if we can figure out how to do, one of the things PDS does so well is as the DSO is just scale, right? With 855 offices across the United States, we've been able to just grow and scale. Now, we don't plan to have 855 special needs clinics. I have a little bit of hair left, but I don't think I'd have any after that point.
Not yet, Kyle, not yet.
But we would at some point. Could we have 10 of them? And we want these to be just hubs and where we're able to bring people in to learn and grow and spend time with us and serve this patient population and really take away some of those stigmas. So with us, it's just continuing to get more people learning, more people involved, more people aware of what we're doing, and really to just and by having these residents in, it allows us to see more patients on our day-to-day every day. And so we're just super blessed to have them involved, and so far it's been great.
It's such a win-win because dentists want to give back to the communities. They want to be philanthropic. And then there is such an incredible demand for this. Like you were saying, people come to the clinic and a weight has been lifted off their shoulders just to know that finally they can get the access to care that they need, or their child needs, or their.
And so many, with the dental schools or the community clinics, I mean, the wait list is just a mile long because they just can't get everyone in. So we're trying to narrow that and get the treatment that people need.
So how can others get involved in helping the special needs community receive the dental care that they need?
Yeah, there's so many ways, right? And I'd say a couple of the easy ones. There's some big ones and there's some easy ones. The first one is there are so many great CE classes out there of just continuing to get more and more educated. A lot of times for clinicians, they've been out of school a long time and maybe they didn't get that training, but finding some of those CEs, continuing to learn and grow in this space. And even taking some time, there's an amazing program. One of the people we work really close with, Dr. Steve Perlman, who's been connected to Special Olympics for a long time. I like to call him the godfather of special needs dentistry. But there's such great opportunities to even dip your toe in some of the Special Smiles events that Special Olympics puts on. In these weird times where, they're not doing as many events but when life gets back to normal, really getting involved and doing some of the screenings and if nothing else, come check us out. Come get involved if you want to come and volunteer or spend a day with us or just see how things are doing. We'd love to have you. I mean, that was part of this. One of the reasons, we put it in Arizona is because they do have kind of a volunteer license, that you can get in Arizona. So come on in and spend a day and learn and see patients and help this out, because we'd love to have volunteers come be a part of this.
Excellent. Yeah, it sounds like you both are doing some wonderful things, and we hope that next year when we have you on, you can talk about either opening up another clinic, or we could talk about all the residents that have been through the program and a little bit about that journey. And hopefully they're able to take those skills back to whether they open their own pediatric practice or their own practice, or whether they go work for PDS or another DSO, but they can help serve those special needs patients at the practices that they end up participating in or owning or what have you.
Yeah, that's a great point. Just find a way, open your doors and be a resource for it and just, give it a shot. You can do it.
Yeah, it's such a great way for residents, like Dr. Akilesh was saying, to see that DSOs really, what they really are all about. And of course, PDS is phenomenal DSO. So they get a taste of what a DSO is, and it might just be the right fit for them. And then they can tell other people about it too. It's just a wonderful program.
Well, and as I take off my, my foundation and just put on my CSR PDS hat, one of the areas that I love, as a DSO, is just challenging within the market of all of us. It's not a competitive edge. The more we all give back and serve, and the more we can all be trying to outserve one another, all it does is raise up, the goodness of it all. So I love to, when we're out there and all of us are, we're competitive in this space, but if there's one thing that I would love to see, it's like who can outgive the other, because that's ultimately just shows more of what we're all about as DSOs.
Dr. Akilesh, did you want to add anything to that?
Yeah, I just wanted to mention that that I feel really privileged to have a site in Phoenix where our residents can rotate specifically to get experience with patients with special needs. We do not have a site like that with any of our other sites across the country, where they have one clinic that's just dedicated to special needs patients. And so I think our residents in Phoenix are extremely excited and extremely grateful to have that experience. I think it does a wonder for the curriculum. I just heard from our second year residents that they're studying for boards now, and all of the conditions and syndromes that they're studying, they're actually getting to see patients that have those conditions at the special needs clinic.
That's
and
great.
The ones that they haven't studied yet, they're actually looking them up while they're at the clinic. And I think that there really is no better way to learn when you're not just memorizing a condition, you actually remember the patient that had that condition and how you took care of them. So I think it's an amazing experience.
And just to clarify, the Dentist for Special Needs Clinic they see adults and pediatric patients, correct? Yeah.
Yeah, and we, one of the things that we do, we see from, I think our youngest patient has been 2, up to, we had this very sweet, I think they were 96, and everywhere in between. And one of the things we're really trying to do is make it friends and family. We had a story the other day where a mom brought in both her son with autism and then her neurotypical daughter. And it was amazing to see, as we have one of our rooms, we have 2 chairs next to each other. And it was amazing to see the difference in the behavior when the sister modeled how, sitting in the chair, being, listening to the dentist, opening up, and how much better that situation went when the one patient was able to see that this is safe, this is okay, look at sister's doing a great job. And so one of the areas of just being that place, the dental home for the whole family. So we're trying to make it, there's nothing, both inclusive and a dental home for everybody.
Excellent. So Dr. Akilesh and Kyle, thank you both for joining us. I really appreciate it. And let's check in maybe in 6 months or a year and find out how things are going.
Oh, I'd love it.
That would be great.
Thanks for joining the show.
Yep. Thanks again, Kyle.
Thanks so much for
Dr.
having us.
Akilesh. Yep. We appreciate it. This is Bill Newman and Kim Larson, and this is the Group Dentistry Now show. Until next time.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today and please tell your colleagues about us.